What's up YouTube, Dr. McIntosh with Health and Performance Center here. Wanted to hop on here and make a video about disc herniations. So again, I am Dr. McIntosh from Health and Performance Center in St. Louis, and this is disc herniations. So, number one, what is a disc herniation? Well, before you learn that, you need to know some basic anatomy. Here's a good picture of a spine from the lateral angle. So you've got bones, those are those brownish things, and then you've got discs in between. So an injury to the disc in your back that can, not always, can cause some severe pain and disability. So, next. What is a disc herniation? Here, this is slide number 2. There are 4 types of disc injuries, right? So you've got a bulging disc, you've got a protruding disc, which is a more severe type of bulge, and then you've gotten to the realm of herniation. So the left 2 are more on the bulges, the right 2 are more on the herniation side. So when it's extruded, that's herniated. It's broken through all the layers of the disc, and then the right is a sequestration, when fluid in the disc kind of separates and your body starts to break that down, and there are individual pieces. Sometimes you can get a sequestered disc in the lateral recess of the spine there, which can cause some serious pain. But anyway, these are the 4 types of disc injuries. So how do you diagnose a disc herniation? Well, number one, the history is huge. Listening to someone talk. Did they have a change in activity? Did they go from not working out to now they have a New Year's resolution and they're doing power cleans 3 times a week for 50 reps at workout, right? What is their mechanism of injury? Was it, are they shoveling? Are they doing some yard work and they've been twisted and lifted? That's a super common thing. And then another thing you can get from the history is the quality of pain, how they describe it. A true disc herniation that has been inflamed and now it's inflaming a nerve, maybe coming in contact with a nerve root in the low back, they kind of describe that as a burning. It's a very distinct pain if you've had that before. I have. It's very uncomfortable and it's very different than a bulging. If someone says they've got shooting pain or they've got lightning bolts in their back or down in their hip and through their buttock, down the back of the leg, that's probably not a herniated disc. It could be, but that's more descriptive of a bulged or a protruding disc. Next, what orthopedic test should you do? Well, one, you should see a qualified medical provider who can do some orthopedic tests, but number 2, they're generally unreliable. I mean, they're in the literature, it kind of says a straight leg raise, slumps test, and then some neurological tests like dermatomes, myotomes, DTRs, etc. that can sort of show you the degree of how inflamed the nerve root is, but otherwise it's kind of unreliable. And then repeated movement test, which can kind of show you some immediate positions or exercises, etc., that can give you some pain relief. Oftentimes, almost 100% of the time in my practice, there is a position that we can find that gives relief, and almost all the time it is some sort of extension-based protocol. Now, the elephant in the room, imaging. Do you need imaging? It's a huge question that everyone argues over, and I would say it needs a little bit of context, right? So I would say yes, if you want to correlate your specific pain and the history of your accident with imaging. And know that if you get imaging, you're probably more likely to go the medical route, whether that be pain management or surgery. And do you need imaging? No, if your answer is that you find a qualified conservative care professional that can find a directional preference, give you some tolerable scaled exercises, things to do at home to keep moving, and somebody that knows that when they do long-term studies of conservative care versus surgery, the outcomes are pretty similar in the long term. So I think conservative care wins in the case of disc herniations. Now what? You have a disc herniation. Well, you kind of need to do three things. Number one, we need to find what's called a directional preference, which is a position, a movement, an exercise, something that can give you immediate relief. Number two, some sort of manipulation, whether that be an adjustment from a chiropractor or a certified physical therapist, some sort of manual decompression, whether you get that a Cox table or something of the sort, and then some type of mobilization, whether that be soft tissue or joint, to sort of prep or set the stage for really good rehab. And then number two is an exercise prescription, something, a plan that you know that you can follow that is going to be scaled to your current level of ability or disability, something that is going to continue moving, because the phrase motion is lotion, right? You have to keep moving. So stay tuned, guys, for more videos about disc herniations. Thanks for watching.